from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Hey, welcome back, everybody, to Good Morning Arkansas. Dr. Scott Davis, cardiologist from Baptist Health, is in here this morning. We're talking about something you've probably seen a lot of the last few years. E-cigarettes. This is something that new research has now come out with, and there's been a lot of questions I'm sure you've been asked over time, Dr. Davis, because what do we always talk about whenever we're talking about heart disease or anything heart-related? What do you always say to the folks at home? Number one thing is to stop what?
Stop anything you're doing that could be negative for you.
Smoking being number one.
Smoking, and then start exercising.
Yeah,
right.
of course.
So the smoking piece is like this. Here's where the e-cigarettes fit. They came out about 2006, and man, they have exploded.
Yes.
Okay, and so at first blush, it's like, oh, it's got to be safer. So therefore, there must not be any harm at all, right? So the current data right now, we're going to talk about it, is such that you don't need to get lulled into this false sense of security about electronic cigarettes. The current study looked at people ages 21 to 45 over a year, okay? And they otherwise had not smoked tobacco, no other risk factors for heart disease, but they looked at then certain variables like heart rate variability, oxidative LDL, all these kind of markers that we've shown over the last several decades that increase your risk for developing early onset heart disease. And it's present. So when you break down the e-cigarette, we'll acknowledge, look, it's not, so you're not burning a toxicant like you have traditionally been exposed to that has all the carcinogens that are associated with like lung cancer and this kind of thing. But there's still chemicals that are still present in e-cigarettes that are also found in regular tobacco cigarettes like formaldehyde and other toxicants that are associated with increased risk of developing heart attack and stroke, such as clotting risk and developing plaque. And so people need to understand that, look, at the core of this is nicotine. And nicotine is a drug just like alcohol and heroin, right? And so it is a tough thing to get. Terribly tough. And so at the end of the day, the process needs to be, I need to get off nicotine. And so what I'm trying to emphasize is you don't need to have a false sense of security that if I'm going from this to this and this is electronic, this is okay long term, because we just don't have that data, right? And so all these early markers are starting to say, well, you know what, we don't need to be led into this false sense of security with electronic cigarette. More and more data is going to emerge, but we just need a timepiece to start seeing like in mortality type data as far as our end game in this.
Because there were the age group you mentioned, 21 to 40, you typically don't see a lot of mortality in that range as opposed to an older age group that would be tested, right?
That's correct, but we're still seeing these changes in these markers that we have found on previous research in these age groups with smokers that then ultimately led to then more increased risk for developing heart attack and stroke down the line. So the take-home message is, if you're transitioning from cigarettes to e-cigarettes, then use it as a crutch to ultimately get off. In other words, you eventually got to keep them on the shelf.
Gotcha. So other alternative methods, we've had these over the years, the patches, the gum, stuff like that. You know, maybe cigarette to e-cigarette, and then progressively keep going. Don't just go to an e-cigarette and then stay on it forever.
I'm going to stay on it forever, right? Because emerging data is just starting to suggest, wait a minute, this notion that, my cancer risk may be reduced, but my cardiovascular risk may not be mitigated. It may not be buffered as much as I think it is.
Okay, so some important things to remember, and this new research, of course, is something that will be expounded upon for years to come.
This came out in JAMA, and so there'll be more and more data that'll start to come out as we look on longer term. This was over a year. We'll start to spread this out 3 years, 5 years, 7 years, and get bigger and more robust data for these patients.
And what would you say to viewers who maybe have been smoking for a while, for years and years, that say, well, I've already been smoking for a long time. Is it too late to quit, or is it never too late to quit?
The smoke them if you got them mentality is bad logic, you know, and it's well, I've been smoking since I was 14. I do it all the time. You know, look, there's been robust data to show the day you stop, then all of a sudden the needle starts to shift back the other way, right? It starts to improve your risk for cancer, for developing emphysema, for developing heart attack and stroke. So there is never a bad time to quit smoking.
The body will start the regenerating process or the rebuilding process.
Absolutely. And so, I mean, nobody live longer smoking more. You know, I say this all the time. So anything you can do to get off cigarettes, whether it's hypnosis or patch or gum, whatever it is. But I will say this, you've ultimately got to find the trash can. You got to do two things. One, you got to quit buying them. And number two, you got to throw them away at the house. And that's where you need to start metaphysically.
All right. You can start that like right now. now, as
Absolutely.
Dr. Davis just mentioned, folks. All right, he is from Baptist Health. You can always contact Baptist Health if you need help, maybe stopping smoking, if you just want to get involved in some of the programs over there to get healthier altogether. It is the new year, of course, and we are well into it, so you can always get healthy with Baptist Health. They've got great programs there, and contact 1-888-BAPTIST or go to baptist-health.com. Dr. Davis, great to see you as always. Thank you so much for coming in.
Thanks, Chris.
We'll see you next time.